I was just wondering that the 300,000 workers who were told they were going to be getting the vaccine, that program's now on pause. I'm wondering what happens when you get an update on AstraZeneca. Do you pull that pharmacy supply and return it to the priority frontline workers, or is there some other option?
Yeah, so obviously we're looking at whatever option we can do. What we didn't want to do was hold up use of the vaccine while we were waiting. So this is what we're doing right now. We can also stream workers through the pharmacies where the vaccine is. So we will be looking at that in the next little while. I will say that with the initial amount that we did receive and with our program that we have been from the very beginning looking at managing outbreaks in workplaces, we have gone a considerable way at some of the highest risk workplaces. So we call it the food and farm. So we've done a lot of the manufacturing, the food processing plants across the province. We were able to do much of that before we had the safety signal using combinations of vaccine that we had available, as well as some of the larger outbreaks in manufacturing and the group accommodations in farms, and making sure that we continue to provide protection to the temporary farm workers, for example, who are going to be working and living in crowded accommodations on farms. So we've gone a long way to getting some of the highest risk industries, but we're not where we want to be, obviously, and we're looking at how do we best restart that program as quickly as we can.
Do you have a follow-up?
For those communities that had now are going to be seeing the AstraZeneca supply coming through the pharmacies, can you give us an idea of how many people will be in that eligible age group of 55 to 65, and then how many doses of the vaccine will be available for distribution through that?
So we have about 700,000 people in the province between the ages of 55 and 65. So as you can tell, we do not have enough vaccine to provide it to everybody. But it's a way of jump-starting that part of the age group as our main focus with the AstraZeneca and the Moderna vaccine and the age-based program moves steadily down the age range. So we have about 200,000 doses in the next couple of weeks. It's been part of our challenge. We are expecting in Canada to get more from the Serum Institute of India. However, we know what's happening in India right now, and there's quite a large surge and outbreak there, and they are using almost all of the vaccine that's being manufactured right now domestically. So we don't know when the next supply of that will come in. So what we're trying to do is match as best we can supply when it gets here, getting it out to people as quickly as we possibly can. And I don't know if you want to talk about so what we're doing, it is proportionate to population in different communities, and really focusing on those communities that are having the biggest challenges with transmission.
Hi there. Thanks very much. I just wanted to start with a question from one of my colleagues. We're hearing urgent calls to vaccinate younger frontline workers to combat the rapid spread of the disease. And with AstraZeneca only available for those 55 to 65 for now, would you consider diverting some of the Pfizer and Moderna doses that are now destined for the age-based vaccination program instead to frontline and essential workers in BC?
So all along, we have been targeting those higher risk workplaces, and I think I mentioned we started a workplace task group in November last year when we started to see increased transmission with our second wave. And so we have been working with WorkSafe BC, with the environmental health officers, our public health team, to manage workplace outbreaks and to identify those highest risk ones. So we have targeted both Pfizer and Moderna and AstraZeneca when it was available to the ones that are highest risk. And we absolutely recognize, there's people who work in our food processing plants. Often both parents are working. They don't have necessarily the ability to take time off. It's very difficult in those environments to wear PPE every day and to have the barriers in place. So we have directed vaccine at protecting those workplaces. And we also know that our first responders in particular, who are doing an amazing job in a very difficult circumstance, but they also are having having very low rates of transmission. So this is the good news, and we are continuing to support them and to make sure they have what they need to protect themselves. And as soon as we have vaccine available, we will be restarting that program. But we've been managing the highest risk workplaces first. And quite frankly, they often are the larger workplaces where people are more poorly paid. And we know that it involves many of our racialized communities, people who live in large multi-generational homes sometimes. And so that has been our focus to start with. But yes, we get that program back and running as soon as possible.